All right, we're going to talk about pain after a C-section. So everything they give you in the OR through your spinal takes about 24 hours to get out of your system. So that's where we talked about the itching or the nausea you experience kind of lasts the first 24 hours for some moms, but that's because that medicine is out of your system. Now, with that medicine getting out of your system is typically when you are in the most pain. So I always like to tell my moms about this kind of on the first day, or if I come in the second day and I ask how they are, I let them know about their pain medication options and let them know that they probably will be experiencing more pain today and they may end up needing medication that they hadn't before, because I think going into it knowing that is really, really important, and knowing that it's not anything that you're doing wrong. It's not necessarily that anything's wrong. It's a normal thing that you may experience more pain about 24 hours from your C-section. Now, saying that, some moms, they aren't able to get a spinal. Maybe the medication didn't work. Maybe they had some kind of contraindications to the medication, or maybe it was a true emergency C-section that they didn't have time to do that. And so they ended up having to put them under. They may give you a PCA pump, a patient-controlled pump, and with this, it's the ones that you like push the button and it gives you the extra doses of medicine. They may have you on that for the first 24 hours, but that's not usually as common as having just the spinal that takes about 24 hours to get that medicine out of your system. So regardless of how they do the medicine the first 24 hours, whether that's the spinal that's in the OR or whether you have a PCA pump, you have your IV in for about the first 24 hours, and they can give you medications in between scheduled things or scheduled medicines, either through the IV or by mouth, what we call PO. And that can kind of look like different things. Toradol is really common, Percocet, oxycodone, Motrin, different things like that are really common that we may see. Some people will even do different kind of like nerve medications, Tylenol. So every provider does things a little differently, but typically you do have medicine scheduled, and then you also have medicine in between that we call PRN. That means as needed, and you may have to ask for that medication. And I think that's important to note with any kind of pain after having a baby, is that some of it is going to be scheduled and some of it you're going to have to request, or just let the nurse know that you're hurting and she can talk to you about your pain medicine options. I personally really like to start my shift by talking to my patients and telling them what kind of medication options they have and kind of what the plan is for today. So you can ask that, like, what do I have scheduled, what's as needed, and like what are my options that I have here, what kind of things should I expect for today. That's a real good conversation that you can have with your nurse at the beginning of their shift. After your C-section, sometimes you may have a burning sensation at your incision, and this is just those nerve endings kind of that's all been cut firing. And so this usually lasts maybe the first 2 weeks. You may have this at times, and ice pads can be really helpful during that time to put on your incision just to help with that burning sensation that you may have. When I was experiencing this after my C-section, I actually thought that it was infected and something was wrong, but it turned out to be just regular nerve pain that a lot of moms experience. But a lot of them don't experience it inside of the hospital. It's usually about 2 days, 10 days post-op that they're feeling that. Whenever you do cough, sneeze, laugh, vomit, anything like that, you're going to want to do what we call splinting your stomach. And this is just taking a pillow and helping support your stomach. Now, like I talked about, your incisions aren't, or your organs aren't just going to pop out and everything, but it does really help soothe your stomach. It does help any kind of like tearing from happening, and it just helps you feel more supported and not as sore. Those first 24 hours, you may not realize that you feel as sore, and if you start throwing up and things like that and not supporting your incision, the second day you may feel more sore. So it's really important to support your incision by splinting, and there's a picture in here for you of that. With a C-section being a major abdominal surgery, gas pain after a surgery is really common. And so sometimes I'll have moms explain this where they feel really sore in their shoulders. They just like really ache. They feel like something's wrong, and it is actually trapped gas that has got up here. So some providers will order around the clock simethicone, or you may hear it called Gas-X, to help break down that gas. So it doesn't make you pass the gas, but it helps break it down so that you can pass it. Getting up and walking is one of the best things that you can do for gas pain because it helps your body get rid of that. Also, being on your left side whenever you are in bed can really help with that gas pain as well. For some moms, this is almost worse than the incision pain. It's just this really odd pain that is stuck in different areas. And so getting up and moving is honestly going to be one of the best things that you can do to help get rid of that gas pain. I know the process of getting up and getting down doesn't feel really great with your having your incision, but once you're up moving around, it's a great time to take a couple laps in the halls, things like that. Whenever you think about getting up and moving, it sounds really silly, but think about using your leg muscles. So naturally, a lot of us, we use our abdominal muscles to move, but if you really think about using those leg muscles when you get up and when you get down, that can be really helpful. I use the phrase a lot of times for moms when we get up the first time, think about standing nice and tall, because a lot of people kind of hunch over, but if you stand nice and tall, that can really help. And the abdominal binder, I'm telling you, is something you want to be using after a C-section. If this is your first baby, you probably won't be offered a tubal ligation, but for some moms, they do end up having this for whatever reason. This is where they either cut or tie your tubes. And with this, sometimes providers will say, oh, it's just like a little extra surgery, no big deal. And while it doesn't take that much longer in the OR, it does cause a lot more pain because there is more tugging, there's longer that you're open in the operating room, and it is a second surgery, so you probably will be more tender with that. And I always want to make sure that moms know that who have a tubal, because sometimes you come in and you think it's going to be one thing and then it's another, and having that extra pain can really worry you that something is wrong or that you've messed up something. And so knowing that a tubal ligation is going to cause you more pain. Now, this isn't to like discourage anybody if that's what they want to do, but I think that it's really important knowing that going into it. Just to recap, one of the things and kind of refocus about is making sure that you are talking with your nurse. If you're sore, they will send you home with medications. Most of the time that is some kind of narcotic that they're sending you home with. But even Motrin, taking a Motrin around the clock once you go home can be really helpful as well. Not only is that a good pain medicine, but it's also an anti-inflammatory that can really help with that incision pain. And I don't want you to feel like you have to suck it up. Oh, it's just a C-section, it's no big deal. It is major abdominal surgery. So wear your belly binder, get up and move around, keep your incision clean, and ask for pain medications if you need it. If you are in too much pain to where you're not moving, you're not able to take care of your baby, then that's not doing anybody any good. Listen to your body. If it feels like too much, it probably is.